You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto. Today, we're going to talk about breastfeeding, and we have a very actually special guest. We have Dr. Patricia Ko with us. But before we begin the conversation, I'd like to give a shout out to those viewers who are watching from Honolulu, Hong Kong, Dubai, and Madrid. If you consider, I know some of these viewers are Filipino, and if you consider getting checkups when you come home, certainly do it at a place at least as good as Makati Medical City, where Dr. Ko incidentally practices. Okay, so before I go into greeting other people and all that stuff, because we have some greetings here, let me join me in welcoming our guest. She's Dr. Patricia Florestin Ko. She's an OBGYN specialist and an IBCLC specialist in Makati Medical Center, of course. And actually, Dr. Ko is a repeat guest. Yes, this is her second time with us or third. I'm not sure, but for this season, second, okay. I do remember the conversation we had before. This is the second time. See, she's raising her hands. Do you remember? Yes, she does, of course. And I'm so happy that she's back. Dr. Ko, you have the honor of being the first repeat guest on this season of Healthline with Makati Med. So welcome back. How are you doing?
Hi, Nicole. I miss
Hello,
you.
Dr. Ko. I miss you too.
Yeah.
You look good. You're gorgeous. Damn, girl. Anyway, you are gorgeous. You look good. And I hope that, everything has been well with you. We haven't seen each other in quite a while. I'm sure, something had to do with COVID. If not, I would have visited you. But during the pandemic, I'm glad that you survived that. And welcome back to the show. Okay.
Hi, I'm so happy to be invited again. I'm so happy to be talking again about breastfeeding and not the usual COVID. Because we're now in the new normal. Yeah. And thank you also for helping me with my guitar.
Yes, I remember that. Okay. Yeah, now that you remind me, I remember that. But usually when it's those things, I hope you're enjoying the guitar, or whoever is enjoying the guitar. That reminds me to get back to my guitar. My guitar.
I know you play very well.
How do you know that, Doctor?
Because you played the guitar.
I did, but okay. All right. Well, for those watching also and those listening on traditional radio, Dr. Ko, I'd like to greet them because it's important to know that many of our listeners also listen to radio or they tune in live through TV, like as the ad said, as the merch plug said, Sky Cable 224 and the other boxes, GMA boxes, they're all there. You can always find us. You can always find DZRJ 8:10 a.m. Radio Bandido TV. You can always find it there. You can find also the other RJ channels. But I'd like to really give also I'd like to note the importance of those who listen to us through traditional radio. And many of them, or a number of them, are seniors and persons with disabilities. And I'd like to say, I'd like to make a personal statement before we start the Dr. Ko. Persons with disabilities and seniors are very close to my heart. Like, some people are drawn to children automatically. I mean, it's not that I don't like children. It's just that ever since I was a child, I've had this special thing, that has drawn me to them. So I just like to say, I just like to give a shout out to them. Those who take the time to listen to us. I mean, some cannot see, and they do listen, and I hope that they're enjoying this second season and that they do call in. And by the way, anyone can call in and send your messages, send your text messages. After all, as we say on Healthline with Makati Med, you've got questions, we've got answers. And guys, don't tune out. There's important stuff for you too when it comes to breastfeeding, no? So you do have, by the way, men have breasts also, they just don't. Okay, Dr. Ko, before we begin our conversation on breastfeeding, just to kind of lay the foundation, and you please jump in and correct me anytime, okay? Because I know that you know about basic science more than I do, and then you know a whole lot more since you studied to be a doctor and you are a doctor, you're a good doctor, and then of course you studied more when it comes to your specialty. I just like to explain to those who are listening and viewing. We're mammals, right, Dr. Cole? Okay, so some of the features of mammals are that you bear your children. You don't like lay eggs and then wait for it to hatch. And then we have hair, fur, and we have 4 limbs, so our 2 hands and our 2 legs. And of course, we have mammary glands, and the breasts are mammary glands. Okay. By the way, whales are mammals too, guys. You just can't see their lower limbs very quickly because they've adapted to life in the water. But they do have 4 limbs, they do have hair, they bear their children, and they also breastfeed them. So if you're into whales, they are mammals like us, and so are other animals. But I mention whales because they're probably one of the most fascinating type of mammals that we can't, like really sort of get to in the water. And they always seem to protect human beings for some reason, Anyway, Dr. Cole, so our breasts are our mammary glands. So what is one of their functions?
Well,
When it is
yeah.
breast. Okay, go ahead, Dr. Cole.
So the reason why females have mammary glands is to produce milk. So that's really the function of the mammary glands.
Yeah, okay.
Also, they also have an aesthetic function.
Yes.
Yeah, so they're pretty to look at, nice to hold, but it's really for
Yeah.
the breast milk.
So
For the breast
mine
milk.
might have wine in them if you perform a miracle. Okay. Yeah. So that their function is to. Sorry, I
Yes.
interrupted you.
To breastfeed. So we know
Breast.
that humans, the best milk for humans is human milk because it's species
Yes.
specific. Rather than cow's milk or goat's milk,
Mhm.
there's less risk of any adverse reactions, other allergy, irritable bowel disease, because that's really the perfect nutrition for the newborn humans.
So, Dr. Ko, is that like one of the benefits, and maybe if there are other benefits of breastfeeding for both the mother and the baby, can you tell us about the benefits a little bit more? I know you mentioned that it's best for babies because it comes from us. It's a species thing as opposed to cow's milk. Yeah, we drink cow's milk and goat's milk and all of that. I guess in formula also, especially,
Yes.
there's milk from other animals or other mammals. Hopefully we don't get milk from reptiles or other kinds of. But yeah, can you tell us some of the benefits? You mentioned some of the benefits for babies. Maybe there are benefits for mothers as well.
Okay, for babies, of course, it's the perfect food for newborn babies. Babies 0 to 6 months of age are encouraged to purely breastfeed, and then from 6 months of age to 2 years and beyond, they can still continue to breastfeed, but already with complementary food. So it's the perfect nutrition because it's very easy to digest. Usually, the babies don't develop colic, no abdominal pain, less risk of irritable bowel disease, which is also a very big thing right now, right? A lot of people
Yes.
irritable bowel syndrome. For example, celiac disease, we hear that.
Yes.
Yeah, right? Because of many allergens or very big proteins in cow's milk or other foods like dairy products. And human milk contains antibodies. So these antibodies, for example, if the mother had COVID-19 infection when she was pregnant, of course, the antibodies against COVID-19 pass through the placenta and will reach the baby. But there are also antibodies that are in the breast milk. So the baby who doesn't have vaccination against COVID-19, for example, and who has a very weak immune system, will get those antibodies. So it's really, there's protection, not just against COVID-19, for example, flu. So if, for example, sometimes you can see that the whole family is sick with flu or just the cough and colds, the ordinary cough and colds, but you will see that the breastfed baby is fine because the mother has the antibodies, gets the antibodies, and will pass on the antibodies through the breast milk.
Okay.
There are other benefits. For example, there's less risk of gastroenteritis. So
Mhm.
that's a very big thing, especially in low resource countries, third
Mhm.
world countries.
Like
Sometimes,
ours.
yeah, like ours, no, a lot of families don't even have access to clean water,
Mhm.
right? It's so hard to clean the bottle or the formula. Actually, the powder in the formula is
Mhm.
not sterile. Did you know
Mhm.
that the powder is not
I
sterile?
did not know, doctor. Is that why they tell you to mix it with hot water?
Yeah, so that's why, yeah. So that's
Okay.
right. You're right that we usually have to mix the milk powder with hot water. So in case there's some bacteria, it will kill the bacteria. But still, it's not sterile. And then sometimes you can see, if the baby doesn't finish the milk, the bottle stays there with the
Yeah.
saliva. Oo. And
The
then it's
crud.
very hot.
Mhm.
So there's the risk of contamination or spoilage of the milk.
Mhm.
Unlike if it's direct breastfeeding, it's always fresh, no? Direct from the breast, freshly produced. And also, breast milk contains secretory immunoglobulin A and other antibodies, which is important so that when the baby is first put to the breast right after birth, the baby's gut is coated with this secretory immunoglobulin A, which forms a protective barrier around the baby's gut, the intestines, in order
Mhm.
to prevent viruses and bacteria from entering the gut, no, the
The
intestines.
gut.
It
Okay.
will also prevent, yes,
So
prevent gastroenteritis.
it seems to help a lot with the babies in terms of stomach illnesses or diseases. And
Yes.
you always hear of colicky babies or umiiyak yan kasi may kabag.
Mm, mm,
That's a thing.
mm.
I mean, it's always there, umiiyak, may kabag, or they do then get colic, then they put, aceite de manzanilla or something and tie up the stomach.
Yeah.
I don't know if my like references are outdated, but it still happens. I see it. And then, so you mentioned a lot of things. Just to recap, it's the benefits for the baby are it helps them not get irritable bowel disease, which is a thing now, and celiac disease, which we hear about all the time. And they also get it's also more sterile if it's direct from the breast.
Mm.
What about, doctor, if it's milk from the breast that you put in a bottle to keep extra milk? Should you refrigerate it?
So usually, if it stays in room temperature for 4 hours, it's fine. But beyond four
Ah,
hours, it's better to either freeze the expressed milk or to put it in the ref.
mm,
So even if
okay.
it's expressed milk, there's still the antibodies that will
Mhm.
help protect the baby's gut. But it's also important for the mom who pumps or to hands express to wash her hands before pumping to make sure that her breast pump is clean, and the way she
Mhm.
gets milk is also a clean technique, no? So she should always wash her hands. Yeah. And the bottle should
Maybe we can
also be
circle
clean.
back to that. Okay, sorry, doctor. Yeah, the bottle should always be clean, you said, and maybe we can circle back a bit to that later, as well as what you said about antibodies. Uh, for babies who are breastfed. And you did mention that you'll see for a lot of diseases or illnesses like the flu or having a cough, like the whole house is sick, but the breastfed baby is not, because the baby has gotten antibodies that pass through the placenta.
Through
And
in the breast milk.
sorry,
And the breast milk.
okay,
Yeah.
sorry, in the breast milk. Sorry. Okay,
Yeah.
through the breast milk. Okay, yes, has gotten antibodies that the mother has already formed.
Yes.
Just you did mention cow protein earlier, or protein in cow's milk for allergies. I just want to tell the rest of the audience and the rest of the viewers like me, those who are not doctors, but I have experienced so many. I have, about my allergies, right? Okay, so like when doctor says protein, it's like usually it's not protein that we think of like in diet terms. It's not like meat and carbo. It's what makes up something. So there's big proteins apparently in cow's milk. It's the basic essence of it, and you can become allergic. As you said, you can develop allergies and stuff. And is that how we can get sometimes like lactose intolerant? Perhaps.
I
Do
think
you know?
it's a little bit different.
A
Yes.
little bit different,
Yeah.
but that
Different.
But that
But
contributes.
very similar. Yeah. Not
Okay.
exactly the same, but maybe there's some similarity. So,
Okay.
yeah, because the protein, no, the amino acid, you're right that proteins are made up of smaller building blocks called the amino acid. So there are many
Mm.
kinds of amino acids. So usually the proteins that are found in human milk are smaller. So they're easier
Okay.
to digest by humans, no? Parang it's easy for the humans to break it down. Unlike the protein found in cow's milk, which is bigger and is harder to
Mhm.
break down. So that's the reason why also babies who sometimes drink formula, they have more kabag. It's harder for them to digest
Mhm.
and to, metabolize the formula milk. Yes, but it not all
Okay.
babies
Great.
naman develop allergy. I'm not saying na so if you give
Yes.
formula,
Yes.
sure you'll get allergy, but there's a higher chance. Now, sometimes
There's
also
a
the breastfed mother eats a food that the baby's allergic to, then the baby can also develop allergy. But most of the time, there's the greater risk of allergy, of rashes, of
Mhm.
diarrhea among babies who were given formula milk.
Okay.
Yeah.
Thank you, doctor. And then I want to ask you, how do you know if you're giving the right amount of milk to your baby if you're breastfeeding? What is a good and steady supply of milk, if anything at all? Like, just can you give us some kind of guidelines for that? Can you give the mother some kind of guidelines for that?
Yeah, so that's a very good question. That's always a question that is asked of us, no, lactation consultants, because in when you give the baby the bottle, you can really measure exactly how many ounces the baby got. So
Yes.
the parents have oh wow, my baby already drank 2 ounces, diba? Wow. But in breastfeeding, you don't measure it because the milk comes directly from the breast to the inside the baby. So how will you know? So that's a common concern now. What if my baby's always hungry? Maybe my
Mhm.
baby's still gutom pa rin or
Mhm.
dehydrated, no? Baby's not getting enough milk. So how do you measure that? So usually it's normal for newborn babies to lose weight, but they shouldn't lose more than 10% of their
Okay.
birth weight. So usually in the hospital, while the baby still, the mother and the baby are still admitted, that's the reason why we measure the baby's weight every day. So we check, is the baby losing weight? It's normal to lose some weight, but not too drastically. And then we also look at the urine output and the bowel movement. So if the baby really doesn't get any milk, then usually we can see that the urine is very dark.
Of the
Sometimes,
baby, no, already.
oo, parang di ba, dehydrated, so dark urine. Maybe sometimes there's blood in the urine or almost no urine. Because usually the normal urine of a newborn baby is clear or very light yellow, and then it doesn't smell bad, not like the, di ba, adult urine. Parang almost like water, right?
Yeah.
Unless the baby, of course, is taking vitamins, the baby's urine
Mhm.
may be yellow. And then the bowel movements, we also look at the bowel movements. So usually in the first 24 hours of life, your baby will have one bowel movement a day. In the second 24 hours of life, two bowel movements a day. In the third day of life, around three bowel movements a day. So the baby should have regular bowel movements, maybe around three bowel movements a day. And the bowel movement will initially be colored black, the meconium, and
Mhm.
gradually progress to brown and then to yellow, no, like mustard, looks like mustard, not formed, and then it's
Is it
colored.
soft?
Sorry.
Will it be soft, the bowel movement? Will
So
the feces be
usually,
soft or?
it's soft. It's like mustard, no? It's not
Yes,
formed.
mustard,
It's like
yes.
parang mustard na.
Yes,
Siya.
actually, I've seen that. I was gonna say it does look like mustard.
Yeah.
You can spread it on something.
Yeah.
Okay, so just to recap what you said, doctor, the question was, how do you know if your baby's getting enough milk? And you said many new mothers come to you and ask that. So, and it's hard to measure when it's directly from your breasts.
Mm.
If you're a new mom and you're breastfeeding, so basically, you can is it that you can tell from you said something very important at first. Babies may lose weight at
Mm.
first.
Yes.
So don't freak out. You know, wag kayong magpanic agad. They may lose weight, pero they shouldn't lose more than 10% of their birth weight.
Yes.
Did they remember? Okay. They shouldn't lose more than 10% of their birth weight. And of course, as you're breastfeeding them, I guess you can tell from their bowel movements, no? If they're
Yeah.
getting enough milk.
Mm.
So it'll be like on the first 24 hours of life, you said one bowel movement and
Yes. Second
one,
24 hours life, 2, and then third
maybe
day
three.
around 3, like that, and then until around 6 weeks of life, the baby will have around 3 bowel movements a day or more. So
Okay.
some
All
babies
right.
even have a bowel movement after each feeding.
Okay, after each feeding. So, and then you also mentioned that at first the bowel movement or the feces or the poo-poo of the baby will be black, and then it will get lighter, and then it will become like it will get black and then green and then yellow like mustard,
Yes.
the mustard color.
Yeah.
Okay, that's making me hungry for some reason. I don't know. Would anyone have a hot dog out there? Okay, so there we go. So basically, you can also tell from their bowel movements. That's natural, and um that would mean that you're giving them, if their bowel movements aren't really corresponding to what Dr. Ko said, then maybe you can consult, because
Yes.
you don't know if your baby is getting enough milk. And when you breastfeed, doctor, because I've never breastfed, is it just like free form anytime your baby cries? Like how many hours usually? Do you have
Yeah.
any recommendations for that, when it comes
So
to
yeah, it's free form.
Mhm.
So we recommend around every 2 to 3 hours, no? So a total of around 8 or more breastfeeding episodes in 24 hours. So
Okay.
again, because that's also tied up with your previous question, how do we know if your baby's getting enough breast milk? So if
Yes.
your baby feeds regularly, sometimes cluster feeding, your baby may feed very frequently in some
Mhm.
parts of the day, and then later on, medyo they're bit more sleepy. But all in all, in 24 hours, around 8 feedings in 24 hours or more, that's also an indication that your baby got enough breast milk. And there are other ways to know, no? If you
Mhm.
want, I can also mention.
Sure, go
So,
ahead.
yeah.
Also,
So,
yeah, go ahead, doctor.
sorry. So, for example, your baby after breastfeeding falls asleep. Parang nabusog siya. Your baby feels
Yes.
relaxed after breastfeeding. So, usually, you can see that the baby's hungry if he or she is wide awake, alert, opening the mouth, and then it's
Mhm.
like putting the hands to the mouth and then squirming. So even before crying, you will know that your baby's already hungry. So you can already offer your breast. Because once your baby's crying, yung talagang screaming and crying, sometimes it takes time to let them relax and, and then take a deep
Now,
breath and then finally breastfeed. Some babies also, when they are brought to the breast too late, parang they don't want to breastfeed anymore. Nagtampo na sila. So it's better yung
you know
early
the whole
sign feeding.
thing.
Yeah.
So just to recap what you said, doctor, there are signs that your baby's hungry. If your baby puts the hand in the mouth, parang they're biting, they're looking for maybe the nipple, but
Mm,
they're putting their hand in the mouth.
yeah.
And also, you'll know if your baby has had enough, yung if after they've breastfed, parang nabusog sila and they're sleeping and they go to
Yeah.
sleep.
They
And
feel
then
relaxed. Mm.
they feel relaxed. And before they get to the crying stage, maybe you can observe if they're exhibiting some of these behaviors, like maybe they're anxious, they're wide awake, you said, and the mouth keeps moving. Okay, all of those things sound like me, even though I'm not a baby anymore. But yeah, that's what happens. Okay. Yes, so those are the signs also. And of course, if your baby's hungry, well, that's a sign that you need to feed your baby or you need to feed the infant. So those are the other ways to know if you're giving your baby enough breast milk. Doctor, can I ask you, okay, what if the new mother feels that she's not producing enough milk to catch up with her baby's needs? Does it happen sometimes, whereas you have problems producing enough milk?
Mm. Yeah.
Yes, it does.
So,
Okay. What can the mother do to stimulate her? I mean, are there any techniques for stimulating the breast for milk to come out?
okay. So, yeah, that's also a very frequent concern because
Hmm?
now breastfeeding is not really that common, or or women breastfeed, but only for a few months. And most of the time, our generation are trying to breastfeed, or actually the generation after me, because I'm already
Yes.
past the childbearing stage.
Well,
No?
you
But
still look like you can bear children. So
tagal na, wala na. Anyway, so anyway, parang the art of breastfeeding kind of got lost a little bit. So if we ask our
yeah.
parents or grandparents, they don't know that much. So we're wondering, ay nako, I don't have enough milk. Or when I pump, there's no milk that comes out. Or my baby's crying, my baby's hungry, no? So first of all, better to consult a lactation consultant or
Okay.
lactation counselor, because most of the time, actually, your baby's getting enough milk, no? You just don't know, because as I mentioned, we don't really measure,
Yeah.
we're not able to measure the amount of milk. So first, consult a lactation specialist. Is it really lack of milk, or maybe your baby's getting enough, but your baby is just sleepy, bored, has colic, is in pain, ganyan lang, no? Or just wants
Yeah.
comfort. Yeah, just wants
It
the
might be
comfort.
it might be that we are panicking, or the generation after us is panicking. And as you said, if we ask our parents or grandparents, maybe it was sort of lost because of the onslaught of the commercialization of formula, and also the whole like really concentrating on work and producing. I mean, lifestyles changed. We know that from history, so, and we've lived through history as well by this time at our age. So it's you, before you panic, consult a lactation consultant, because I've heard things like, drink some beer to produce more milk, or stimulate it by touching it, or have someone else touch it, have your husband touch it, so he has more fun, that kind of thing. And I've heard that from others when they were asking, how can I produce more milk? But as you said, consult a lactation consultant, because perhaps your baby is getting enough milk, and as you said, maybe they're just bored, maybe they're just looking for the comfort of the nipple. And that's why, oh, by the way, we have chupetas, we still have what do you call them in English? Chupetas. Okay. Pacifiers, yes. Do you recommend pacifiers?
Okay. So usually, maybe the pacifier can be given later on when the breastfeeding is already established, because the milk supply is based on demand and supply. So the more the baby sucks from the maternal breast, the more milk will be produced, because it's the baby sucking that will also send a signal to the brain, and the brain will send a signal to the breasts that the baby's hungry, will need to produce more milk. So if we give early on the chupetas, or the pacifier, number one, your baby, if hungry, will not be able to get any milk. And then number two, the baby will not be able to stimulate the mother's breast, and therefore probably the milk supply will not increase. So we don't really recommend it.
Okay, doctor, you're a bit frozen.
Sometimes it can be given if the baby really is very fussy, but that's when the breastfeeding is already well established, when the mother really has adequate amounts of milk.
So in terms of pacifiers, or chupetas as they're widely known here, doctor does not recommend them until the breastfeeding is established. So not very early on, because also breastfeeding is a matter of demand and supply. When the baby suck the mother's nipples, it also sends a signal to the mother's brain that they need to produce more milk. So that's one way also. Doctor, are you with us, or shall we wait for you to join us? I think there is some, I think the doctor has to join us again, because there's something maybe with the connection. These days we're doing things with technology. We're conducting shows through Zoom, and it helps a lot, because then we can get some of the best doctors like Dr. Patricia Ko, even if they're busy, because they can just sit down, set aside a bit of time for a show like ours. And I'm so happy that Dr. Ko said that she was happy to be invited to join again. And I'd love to have her anytime, and all the other doctors who came on before. we're going to ask Dr. Ko some more questions. And if you have questions, we've got answers. You can see Dr. Ko is very open, very game, and she is very intelligent. So please do send in your questions through text, via messaging, and we'll get to your questions. We'll have Dr. Ko answer your questions, of course. And don't forget that you can view us anytime. We are on YouTube. That's DZRJ 8:10 a.m. That's 8:10 a.m. Radyo Bandido. We are on Facebook, DZRJ 8:10 a.m. That's 8:10 a.m. And that's Facebook/DZRJ Facebook/ DZRJ 8:10 a.m. 8:10. And by the way, if you have anything you'd like to find out about Makati Med or any more questions, you can always visit their website and their Facebook page, and sort of roam from there, sort of surf from there, and find out. And by the way, if you have not subscribed yet to the DZRJ 8:10 a.m. Radyo Bandido channel, go ahead and click it. It's free. Okay, and there are a lot of shows, not just this show, that can help people. And you, because like with Healthline with Makati Med, we're trying to help you get a healthy and uplifting lifestyle, or start that. Think about health. There's so many things we can learn here. Every time I do a show, I get so informed by the doctors who are guests. And please, those who are tuning into traditional radio, thank you very much for doing that, and stay tuned. And by the way, stay tuned, because we're going to take a short commercial break, and we'll be back with Dr. Patricia Ko of Makati Med. The topic is breastfeeding, and as you can see, if you've been watching, we've been having fun with it. So stay tuned to Healthline with Makati Med. See you in just a minute.
You're listening to DZRJ 8:10 a.m. We'll be right back after these reminders.
World-class quality healthcare with a heart is now more accessible and affordable with Makati Med Care Access. I am Dr. Jacinto from Makati Medical Center. Our mission is to serve and provide compassionate care and excellent service to everyone who needs it. And now, we are bringing our renowned brand of world-class healthcare to where you are. With Makati Med Care Access, we have expanded our services beyond the hospital premises to serve you in convenient locations where you can avail of premium but economical healthcare. The Makati Med Care Access Araneta City is where we offer health screening and diagnostic procedures. Here, you can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. What's more, Makati Med Care Access Araneta City is the only single-use hemodialysis center in Araneta City. This makes it easier and convenient for patients to avail of renal care services right in the heart of Cubao. Here at 𝗛𝗶𝗵𝗶, another Makati Med Care Access Clinic is located, offering outpatient care like consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby communities who do not want to proceed to the hospital to have these treatments and procedures done. The Makati Med Wellness Center, located at Ayala North Exchange, is a warm and comfortable space where executive checkups and services for holistic patient care and wellness can be availed of. In this wellness center, we have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. It is equipped with modern facilities and has competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services to adult and pediatric patients alike. It is connected to the main hospital by a bridgeway at the side of Ayala North Exchange. To make our services more accessible to certain areas, the Makati Med Mobile Care Access was launched. As the name suggests, this service is mobile. We go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on what your community needs. We can go to any location of your choice within the metro and conveniently offer healthcare services to fit the needs of any community or group. For added convenience, different modes of payment are available, inclusive of HMO benefits for those with a valid letter of authorization. Now that is truly accessible healthcare. All these additional locations under Makati Med Care Access are meant to make it easier for more people to avail of our services. After all, access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For your healthcare needs, please visit us at the following Makati Med Care Access Centers or contact us to come to you and allow us to take care of you.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, so welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. Our guest is Dr. Patricia 𝗂. She is an OBGYN or OB-GYN, as some people say it here, in Makati Medical Center, and she is also an IBCLC specialist. I think that's an international. Dr. 𝗂, what does that acronym mean? The IBCLC. I had it written out, and then I was like, oh, I don't know this. International, I guess, breastfeeding certified lactation consultant. Am I correct?
It means
Okay.
International Board Certified Lactation Consultant. Yeah. So we took an international exam. So it's
Okay.
internationally recognized lactation consultant. So there are a number of us. So Makati Med is really so lucky that we have around 6 IBCLCs, 6 certified lactation consultants. So it's really a very good service, no, in Makati Medical Center. And we even have a milk bank, our very own milk bank. Yeah.
Yeah, let's get to that a bit later, Dr. 𝗂. And actually, Makati Med is lucky to have you. I'm lucky to know you. You said earlier you miss me. Oh my gosh, I miss you. I'm so very fond of you that I want to see you. And I remember the last time we talked, I think we had our show on Halloween, and you were so game enough to say that you would cut out a hole in your shirt and just to
You remember that?
Yes, to expose the nipple for breastfeeding, of course. I mean, that's genius. We were talking about that as genius, cut a hole there so that you can breastfeed. And we had fun that night. We were talking in person in the studio. The energy was there, but I can still feel your energy from here. And I know that the viewers and listeners can feel your energy, and that they will enjoy hearing from you again. But you said earlier you're happy to be invited. Please come back again soon. We can talk about other things that you deal with. I know advocating for breastfeeding, well, informing people about breastfeeding and encouraging them to breastfeed is your advocacy, and that is one of your specialties. But as an OBGYN, there must be other things you can discuss, the whole female reproductive system. Maybe I should go to you. Okay. All right. So Dr. 𝗂, earlier you mentioned how babies probably feed 8 times in 24 hours. So that is that's a full-time job, no? If you're the new mother. So can you tell us about some of the challenges that may be related to that, or other things that new mothers face, that you see when you deal with new mothers and their concerns about breastfeeding?
So yes, breastfeeding is really a full-time job, as you mentioned. So that's at least 8 times in 24 hours, but it can also be 12 times, 15 times a day, and then it's day and night. Can you imagine? So for so many months, or maybe for several years, a mother will not have a full, complete 8 hour sleep na in one stretch. It's so rare for her, and it's such a blessing for her to be able to sleep probably 4 hours straight, no? So it's really tiring and exhausting, and a lot of moms, first-time moms, don't realize how difficult it is. Because when you look at pictures of breastfeeding, yung mother-baby dyads, it's always smiling, na perfect,
Smiling, they
no?
look good,
Maayos yung
makeup.
hair, and then yung gauzy, no, pastel colors. But the reality is very different, no? Very tiring. She can deal with sore breasts. She can deal with
Yes.
not having even the time to go to the toilet, not having the time to eat the full meal, not being able to take care of herself. Painful breastfeeding.
Take a shower.
Sometimes there are also issues of not enough milk. So there can be really a lot of challenges. So what we say is when you're breastfeeding, that's your only job. So try to delegate, try to ask, and also ask for help. Ask for help. Don't be afraid or don't be shy to ask for help from your husband, from your mother, from your yaya, from anyone in the neighborhood or your old friends. Talagang, and then people are willing to help because we know that it can be difficult.
And doctor, okay, you mentioned a few things that brings me to a few other questions. You said, nipples can get sore, they hurt. What can a new mother do if her nipples or her breasts start hurting or they get sore? Maybe some of the things. What can she do to help her overcome that, the pain in her breast?
So first of all, it's best to see your pediatrician or your OB or a lactation consultant. Most of the time, the reason for the sore nipples is the latch is not that deep, no? It's a shallow latch. So it's better if the baby really gets a full mouthful of breast, not just the tip of the nipple, but also part of the areola. Because if usually we imagine breastfeeding na the baby is only attached to the nipple, diba? Because when we see a baby bottle feeding, diba, the baby's mouth is only partially open, nakaganon lang, nakapurse ang lips. And then it's
and
okay.
In the pictures also.
Yeah. But in reality, when it's breastfeeding, the baby's mouth has to be really wide open. And the gums are like in contact with the mother's areola. So try to put the breast and part of the areola deep into the baby's mouth so that it will hurt less. Yeah.
Okay.
So usually it's positioning and attachment.
Okay, positioning and attachment. And let's say most of the time, that there's, for some reason, when you say latch, it's not how the baby comes in contact with the breast. Let's say something went wrong and then it hurts a little, but you're getting the position right. Can they ice their breasts, or I don't know? Can they do that? That wouldn't be bad naman, no? What if?
First of all, it's really to correct the position. Sometimes, cold compress can help. Whatever will help the mom, either cold compress or warm compress. We give also paracetamol. She can take paracetamol. And there's some nipple creams that can be prescribed, like the lanolin cream, or sometimes even an antibacterial cream if there's already starting infection if there's an injury to the nipple, an infection in the nipple, then sometimes you have to give a antibacterial cream. But it's upon prescription of the doctor.
So that's why you said go to your lactation consultant.
Yes.
The lactation consultant can prescribe things for you if you need a cream for your nipple or certain medications. And that brings me to the question, doctor. What does a mother have to watch? The food or medications? Are there any food or medications they should avoid while they're breastfeeding?
Okay, so usually any food is okay as long as she has a balanced diet. She has fruits, vegetables, protein. But what is not recommended is cigarette smoking and then excessive alcohol drinking, and of course the use of illegal drugs, like hard drugs or even marijuana is not recommended during breastfeeding. And there's some medications that are not recommended during breastfeeding. However, most medications are compatible with breastfeeding. So if you have any doubts, if you have any questions, don't hesitate to ask your doctor. And then you can tell the doctor that I'm breastfeeding. I really want to breastfeed. So can you give me a medication that's compatible with breastfeeding? Yeah.
Okay.
Because if we say na, no, you shouldn't take any medicine. Can you imagine a woman is may breastfeed for 2 years and then she can't take any medication? What if she has a headache? Or what if she has a cough or a fever or diarrhea? It means she cannot take any medicine. Or if you say that you should stop breastfeeding temporarily while you're taking this medicine, what about the baby? The baby will not receive breast milk. And once you stop breastfeeding, even for a few days, it can already decrease the milk supply. So that's a big implication. So now at least there's more awareness, and there are also a lot of resources out there. The lactation consultant, your pediatrician, and also you can look at the website of LACNet, no? I think it's free, LACNet. So you can look it up and see if your medicine is compatible with breastfeeding.
And doctor, okay, what if can you breastfeed and have a medical condition or illness? Because what if a new mother gives birth, and let's say she has cancer and she's receiving treatment for that. She's receiving chemotherapy, or she has another type of illness and she needs to take painkillers. Let's say she has some type of neuralgia, or let's say she has MS, no, and she needs to take these medications. Can she still breastfeed?
Yeah, so it really depends on the situation. There's no one size fits all. So usually, if it's only a mild illness like flu, even COVID, cough, fever, diarrhea, and then she still has the energy to breastfeed, she can breastfeed. If she has COVID-19, she just has to wear a well-fitting mask and then wash her hands before and after touching the baby. Don't cough directly on your baby. Don't sneeze to your baby. So it's still fine. But there, of course, you mentioned very complex or, difficult medical conditions wherein it may not be safe to breastfeed. For example, a mom who is recently diagnosed of cancer and she's receiving chemotherapy. So most of the chemotherapy medications are not safe when she's breastfeeding. So she may have to stop breastfeeding temporarily, and then once that it is safe for her to resume breastfeeding, she may. Although, of course, she has to probably pump and dump her milk while she's receiving chemotherapy. For some neuralgias, so there are medications, there are some pain relievers that are safe for breastfeeding. For example, paracetamol, good old paracetamol. Maybe some like mefenamic acid, if it's only taken for a short time. But for long-term intake of NSAIDs, like yung mga mefenamic, paracetamol, or stronger medications, it has to be upon the advice of the lactation consultant and her doctor.
Okay. So if you have a more serious or complex illness like the ones I mentioned, then of course there's a team of doctors that deals with that and tells you, well, you need to take this, it's best for you. Then your lactation consultant, and they can decide and give you advice.
Yes.
And then, but if it's illnesses like the flu or a cold or a cough or even COVID-19, as doctor mentioned, you can still breastfeed. Doctor, we're circling back to that a little bit. No, you said if a new mother has COVID-19, she can breastfeed. Can you tell us a little bit about the because the baby will get antibodies, no? Can you tell us a little bit about that when the baby? Okay, just a little bit about. I'm sure many people are amazed. What? She can breastfeed when she has COVID, right? Okay.
Yeah. Well, because first of all, even before the mother develops symptoms of COVID, we know that 1 to 2 days before a person gets COVID, that person is already infectious. So, for example, the mom, actually, even before she has symptoms and she's holding the baby, taking care, that baby will already get exposed to the virus. Now, Of course, but once you know that she has something going on, a virus going on, still better to wear a well-fitting mask. Just in case the baby didn't get infected, there's still protection, no, not to infect the baby. And of course, the hand washing. Now, why is it still important to continue breastfeeding? Because the breast milk really has a lot of antibodies. So, yung mga common cold, cough, flu, because of the presence of the antibodies in the breast milk, it will help in the baby's immune system. And then the mother, once she gets exposed to, for example, the COVID-19, she will then develop antibodies. That's how we develop antibodies, right? When we get exposed to a bacteria or a virus, our body will start producing those white blood cells.
Antibodies to fight them. Yeah, the white blood cells start producing to fight them. And the vaccine is very much like that, where they introduce, well, at least the old way, no, is where they introduce an antigen, which kind of, and doctor, please jump in anytime because I'm not a doctor. So, you know, where they introduce an antigen by injection maybe, and the antigen has a weakened version of that illness or disease. And then your white blood cells start producing, they're like, hey, there's something here that's not safe.
Yeah.
So they start producing like an army of cells to fight that. And that's what we call the antibodies. So if a new mother has COVID-19, she's already been, or she's starting to produce the antibodies in her body, and she passes on these antibodies. So basically, whatever the mother has, or doesn't have, I mean, no, not doesn't have, whatever the mother has that's good in terms of antibodies and stuff, it gets passed on to the baby. And I think you made a really good point, doctor, when you said wear a mask and don't cough on your baby, because that's the way people get infected. It's not through
not through the breast milk. Yes. Yeah, and then the antibodies are passed on through the breast milk.
Yes. It's our eyes, nose, and mouth that we get infected from, that COVID passes through. It's not like, it can't enter our foot. Or I think if you zap out something that somebody coughed on your food and they had COVID, but you zapped it out with enough heat, then you're dead. So that's the way it gets passed on. That's a great point that you made. Still wear a mask. Don't cough APSDs on your baby, which is like best practices anyway. Doctor, we talk about breastfeeding as being a 24-hour job. Now there are mothers who have to work, or they have to go back to work. Can you tell us something about pump and dump, as you mentioned, or saving up your breast milk, or how can they get over that hurdle where, well, first of all, if you just stayed home and breastfed, it would be a 24-hour job, a full-time job already. As you said, it's not just like you can't schedule it like, feed 8 times between 9 to 5, huh? You can't tell your baby that. Their baby will wake you up at night, and then can be 12 times, whatever it is. And as you said, the new mothers, don't hesitate to ask for help from your neighbor, from whoever, from your baby daddy, whatever. Or, if he's not around, never let him go. Kick him out of your life. But, your parents, your mother, as you said. And how can they, what is pump and dump? And like, how can they store milk?
Yeah. So pump and dump is only used for very select conditions. As much as possible, we don't really encourage pump and dump because that breast milk is so precious. It's already a job to get the milk, right? It's also not easy to get the milk. So pump and dump only in very, very select conditions, like the mother is having chemotherapy, or she has cancer, but eventually she wants to resume breastfeeding, or she's taking a medicine that really is not compatible to breastfeed. So she has to keep expressing the milk, but she can't store it. No, so that's in very special conditions. So once the mother starts going back to work, we encourage her to start already expressing her milk, maybe around 2 weeks before she goes back to work. Because she has to get the hang of either hand expression or pumping, and then so she can have a stash of breast milk already. And she can already try probably at the start, pumping maybe twice a day when her baby falls asleep for a long time, or when she feels her breasts are heavy and then her baby's not hungry, she can pump a little bit, store it. And then once she goes back to work, what we encourage is before she leaves the house, she can breastfeed her baby. That's the last thing she will do. Once she's in the car or in the office, she can try pumping as often as her baby breastfeeds, if she can fit it into her schedule. So if her baby is breastfeeding every 3 hours, she can try pumping every 3 hours. And the first thing that she can do upon arriving home is, after probably cleaning up, having a shower, is directly to breastfeed, so that her baby will be able to empty her breast. So that's a very short recommendation, the simple recommendation that we say to women who are going back to work.
Because we hear that a lot, and we know there's pumping. So pump and dump is a different thing, and that's when you have to pump it and dump it because you have a condition. The opposite of that, or something parallel to that, which is kind of opposite, is you pump and then you store it, so you have a stash. And you keep it in if for 4 hours, you said earlier, about 4 hours, it's good. But then after that, you have to you should freeze it. So freezer. Not refrigerator, a freezer, doctor.
So either refrigerator or freezer. So if you plan to really store the milk for a long time, for maybe around 3 months, then you can put it in the freezer. But if your baby will consume the milk within 5 days, then you can just store it in the refrigerator.
Okay, that's great, doctor. And for women going back to work, or you have to pump for some reason and store your milk, there are different kind of pumps out there anyway. And we know there are electronic pumps where you plug it in, or the ones by hand. But basically, when doctor says express, it's like pumping your breast, like getting the milk out. That your breasts have to express themselves when they're when they're full of milk for your baby. Okay. Doctor, what do you have any kind of skin to skin contact? You mentioned that last time. Can you tell us about that again?
Yeah. Okay. So that's also one of the benefits of breastfeeding. So it's not just the nutrients, not just the antibodies, the hormones, the antimicrobial factor, the perfect composition of all the water, the lactase, etc. It's also the skin-to-skin contact that makes breastfeeding special. So when the baby feels the mother's skin, or even the father's skin, it's very comforting. Imagine the mother, the baby was inside the mother's womb for 9 months. So the baby can feel the mother's pulse, even the tummy growling, the mother's voice, the warmth. So it was like that for 9 months. And then all of a sudden, there's a separation between the baby and the mother. So it's also a shock. So babies usually, they really love the feeling of skin against them. So if you do the skin-to-skin contact, either through breastfeeding or through just putting the baby on your chest, it's very comforting to them. It also prevents them from having hypothermia. They won't feel cold, of course, because that's like a natural heating device, our skin. And it regulates also their heartbeat and their respiratory rate. Because some babies, especially the premature ones, yes. But we know that with SIDS, some babies, they don't have a regular respiration. Sometimes they don't breathe regularly.
Yeah.
But so if there's skin-to-skin contact, their breathing and their heartbeat, there's less chance of apnea. The babies breathe regularly. Their heartbeat also becomes more regular. Yeah. And then there's the emotional connection between the mother and the baby.
I think I should still have skin-to-skin contact with my mom, who is probably watching by the way. Hi, mommy, I love you. I want skin-to-skin contact with you to regulate my heartbeat until it happens.
Agree.
Calm me down.
Diba? Even as adults, we love to feel, diba? That's why we love to hug, to kiss, even just to touch, your loved one's hand. It makes you happy. That's why always this Zoom meeting is not as satisfying, not as gratifying as really meeting your friend face to face. So that's why
Yes.
I guess our
But I'll go and
our
hug you
last
some other time. We'll
interview.
test ourselves and all that, so
Mm,
I don't infect you or happen to infect
yeah, yeah,
knock on.
of course.
I know someone right now who has COVID right now, and I hope she
Mm,
gets well.
yes, yes,
Okay,
of
so
course. That's true,
yeah,
no?
we're
So yeah,
out
skin to
of the.
skin contact.
Okay.
That's so if it's important for adults, it's also very important for babies. So
But it.
actually, the magic of breastfeeding, it's not just the milk, but it's also when you breastfeed, there's the skin to skin contact. So a
Mhm.
parent who, for example, doesn't have enough breast milk, or she has to give sometimes the bottle because there's not enough breast milk, or sometimes it's the father who gives the milk because the mother wants to sleep, they can
Mhm.
also try to do the skin to skin contact when giving the bottle or when the baby's awake and feeling fussy. Do skin to skin contact because that will help in their emotional development.
Mhm. Okay, doctor. What kind of breastfeeding do you offer to new mothers and families? I mean, this might be like your maybe a program you have
Mm,
somewhere in Makati Med. There resources and support that are available for them, for mothers in terms of like they might have postpartum blues. And by the way,
yes.
postpartum, how can skin to skin contact help postpartum?
Okay.
Does it help
Yeah.
or?
So yes. So skin to skin. Some women, they don't even feel that they have a connection with their babies. Parang they don't love their babies.
Yeah.
So it can
Until
help.
they
The
hold
skin to
them.
skin contact can help na they will feel probably more love towards their babies.
Okay.
Sometimes the very difficult breastfeeding can also lead to postpartum blues.
Yes.
So yes, that can also happen. No?
Yes.
So it's not all roses. So there are
Mm-hmm.
instances when the mother is exhausted already. She's trying her
Mm-hmm.
best to breastfeed, but things are not working out. It's painful, not enough milk, she's exhausted, lack of sleep. It can aggravate postpartum depression. But there are also cases wherein that breastfeeding in itself can be satisfying, can be gratifying, and it will help her recover from the postpartum blues. So it's a case to case basis. So yeah, so it's important to again ask for help. So there's the lactation consultants, a lot of lactation consultants already in
Do you have them in
NCR
Makati Men?
in Makati
We have
Med.
lactation. Okay.
Yes, so
Lactation
we have a
consultants.
roster of lactation consultants. Some are even pediatricians and lactation consultants. And then now
But
there
you're
are
the
already,
best.
sorry,
But you're the best.
sorry,
But
it's
you're the
chopped.
best. But
Thank you.
you're the best.
Wow, thank
Okay.
you. Hindi, there are a lot of other very good lactation consultants. And then there are also now support groups like Breastfeeding Pinanays, the Breastfeeding Club, Arugaan, Latch, no? So there are already a lot of peer support groups in Metro Manila. And now probably with Zoom, they can also have like peer support groups even virtually. And then there are also Facebook or Viber groups that can help with lactation support, because the peer support, the mother to mother support, is also useful and very helpful. Sometimes you just need someone to, a helpful ear, someone who can
Yes.
listen to your concerns, and it will already alleviate your problems, right? And
As we see,
okay, sorry.
no, no, sorry, doctor. Go ahead.
Ah, and hopefully we'll be starting a breastfeeding support group for
Mm.
Makati Med employees. So we will start small first. We will start with the employees of Makati Med, and hopefully if it becomes successful, hopefully we can expand to include also the pregnant women and also the postpartum moms. Yes.
Okay. That's great, doctor. Good luck with that. And I hope that everything works out, it becomes successful, and you're able to grow it. That's so important. Doctor, you mentioned group support groups, and sometimes, as we can see in other countries, they do have support groups, and like a lot of them just sit there, and then new mothers, and it's a communal thing, a community thing, where you just want to talk to people who are going through what you're going through. And as you said, sometimes you just need a friendly ear, but you don't need someone like who parang if the person is not exactly open to hearing you and they're not going through what you're going through, then they don't quite get it. I mean, if it's your doctor, they get it. If it's a lactation consultant, they get it. But you can also talk to new mothers. Of course, you won't always, like, in your group of friends, not all of you will give birth and have babies at the same time and breastfeed at the same time. So there are support groups now. And as you said, though, with the Zoom, at least you can see each other face to face and just talk about it. Yeah. With the Zoom or with meeting in person, at least our society is becoming more supportive of new mothers and breastfeeding, as opposed to, being silent about it or not reaching out and helping each other. I'm very happy about that. And thank you for informing us of that, doctor. Doctor, what is rooming in and breastfeeding on demand? And what's your policy on that?
Okay, so Makati Medical Center follows the recommendation of the DOH because we want to really follow the 10 steps in breastfeeding. We are following the recommendation to really promote and support and protect breastfeeding. So how can we do that if we really actively encourage rooming in and breastfeeding on demand? Because as we know, a baby will breastfeed very many times a day. So if the baby is in the nursery, how can the mother go to the nursery every 2 hours, to breastfeed? So what will happen is the nurse will call the mom. The mom will go to the nursery, and then by the time the mom arrives, the baby already fell asleep. So it's very difficult to really breastfeed if you are separated from your baby. So if your baby is healthy, doesn't have to be in the neonatal ICU, it's best to room in your baby. So the baby will stay with you in the room. So anytime, when your baby's hungry, konting whimper pa lang, konting, squirm pa lang, you know that your baby's hungry and it's much easier to breastfeed. So that's the, and then the breastfeeding on demand, kasi yung breastfeeding, it's best to look at the baby, see when the baby's hungry. It's not scheduled na, dapat every 3 hours, 15 minutes per breast. So it doesn't work that way. So the babies are the ones who will tell the mother that he or she is hungry. So that's why it's breastfeeding on demand. On demand.
So it's the demand baby. Okay, so rooming in, first of all, means that your baby, if your baby is healthy enough, meaning they don't have complications and they're not in the ICU of the nursery, or they need to be watched 24 hours by the nurses and the doctors, then the baby stays with you in the room. I think many mothers would be happy about that. I think the thing before was, they would insist that the baby stay in the nursery. And I know a lot of people are like, no way, give the baby to me and put my baby here. So when your baby is in the room with you, they can, if they just whimper or anything, then you can breastfeed them. And that also helps to form a bond. So that is what rooming in and breastfeeding on demand means. And as you said, it's also a DOH policy, or because I guess the DOH is also pushing for breastfeeding in general, like promoting breastfeeding. Okay. So the DOH, by the way, guys, is the Department of Health. Okay. So, doctor, I have more questions for you, but I just want to take a short break. I'm gonna, for those of you who are watching right now, stay tuned, and whatever it is that you're doing, we're gonna talk about donor milk and milk banks. And that's a very interesting thing. Imagine your baby drinking someone else's milk. So we're going to talk about that when we get back from this short break. Stay tuned to Healthline with Makati Med. We have Dr. Patricia Ko with us, and she's one of the best. Stay tuned.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, Hi, this is Dr. 𝗂𝗍𝗂 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, hi everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We have with us Dr. Patricia Ko. She's an OBGYN specialist and also a breastfeeding specialist. Let's just call her that, no, consultation specialist. We're talking about breastfeeding, very interesting topic for everyone. You can relate. You may or may not have been breastfed, but you can relate to all these things. And doctor, before the break, I said when we come back, we'll talk about donor milk and milk banks. And can you tell us a little bit about this practice as it is now in the Philippines?
Okay. So yeah, I think we really progressed a lot with regards milk banks. Maybe around 10 years ago, there were only a very few milk banks, but because of the push of the DOH and because of the need also for donor milk, more and more milk banks have been established, no? And the milk bank of Makati Medical Center is already 5 years old. And we are very proud to say that we have served thousands of sick babies in the neonatal ICU, especially the very premature ones. We have given pasteurized human breast milk to all those very sick babies. Because sometimes when a woman gives birth and then her baby is sick, very premature, very small, it poses a lot of stress to the mom. She's so stressed, no? Diba? So that stress sometimes can translate to poor milk production because milk supply is also dependent on the level of stress of the mom. Or if the mom has a health condition or she really doesn't have enough milk, then we have to give milk to the baby, donor milk. If the baby is a premature baby especially, or a very small baby, or a baby who has an illness, the best milk really is human milk, no? Because for premature babies, their gut is very immature, no? Very fragile, yung kanilang intestinal system. Yeah. And the component of human milk is really very friendly to the gut. The human milk will prevent the onset of necrotizing enterocolitis. So necrotizing enterocolitis is when sometimes very premature babies' intestines necrose, no? Parang it undergoes inflammation, and then it sloughs off, it dies. Yeah, it dies. The intestines die, and it can lead to death of the baby. So imagine, we have so many very premature babies in the neonatal ICU of the Makati Med, and the survival rate is very good. Thanks to excellent pediatricians, the nurses who are in the NICU, and also thanks to the milk that is given to the baby. So either it's from the mother's, of course, priority is the mother's own milk. So we encourage the moms to either directly breastfeed their babies, even if they're in the neonatal ICU, or they can pump their milk, it's given to the baby. But if the mother cannot produce enough milk, that's when the milk bank comes in and gives the donor milk to these babies.
Okay. Doctor, the milk bank. I mean, it's good that that, as you said, the survival rate is very high. As you've seen in the last 5 years, Makati Med has had a very successful milk bank, and it's important, and it's good for. I mean, it's saved a lot of premature babies, because the human milk is best for their gut. No, and if not, this thing occurs where their intestines can die, and all sorts of things. The milk bank, I just want to ask, how do you donate to it? Like, where do you get the breast milk for that bank?
Yes, so we really appeal to the kind hearts of mothers who really have an excess milk, no? So usually mothers who gave birth in Makati Med, and then they know that there's a milk bank, or they're tapped by their doctors na, hey, maybe you can donate your excess milk. So we welcome those donations, because those are really life-saving, no? Those, we call those mom sheroes, sorry, ang corny,
Heroes,
no?
yeah. Shiro. Yeah,
Yeah.
female hero, Shiros, yeah.
Because it's so selfless of them to pump milk and then to just donate the milk so that other babies will benefit, no? So those are really life-saving ways to, you know, it's really so selfless of them to donate milk without getting any money in return. It's their way of paying back, paying forward. There are also some moms whose babies were in the neonatal ICU, and probably before those babies got also donated breast milk, or probably they saw those other babies who needed donated milk, so they wanted to also help those babies in the ICU. Some of the milk also comes from the staff. There's some staff, when they give birth and then they have excess milk, they donate to the neonatal ICU, and also other moms from around the Philippines. No, if they want to donate, they're very welcome. But of course, there's a screening. We do interview. There's also laboratory testing to be sure that the mom doesn't have any severe infections. And after that, we also pasteurize the milk, and then we culture the milk to be sure that the milk is very clean.
So, doctor, basically, you know, we want to thank those sheroes, that you call them sheroes, the moms who have excess milk, who donate if their doctor taps them, and they also gave birth in Makati Med. The staff of Makati Med who may be giving birth and they know about this milk bank.
Yes.
Mothers whose babies have been, who have benefited already from the milk bank, and so they also want to give back. And so basically, anyone can walk into the milk bank and donate their breast milk for the milk bank. They can be a milk donor. But as you said, your standards are that you maybe test them, you interview them, no, and then you test or you screen them. You screen those who are going to donate their milk, and once the milk is donated, you pasteurize them. You pasteurize the milk. So pasteurizing is just cleaning the milk, basically, no?
Yeah, it's heating the milk.
Bacteria.
Yes. So we have a pasteurizer. It's a Holder pasteurizer where the milk is heated for around 30 minutes with a certain temperature. But of course, the milk shouldn't boil because it will curdle, and it will kill also the beneficial components of the breast milk. Yes. Okay. So we have a Holder pasteurizer. After that, we do microbiologic testing of the pasteurized milk to be sure that it's really clean, there are no bacteria in it. And once that it passes the microbiologic testing, it's frozen.
Okay.
And ready for distribution.
So that's great, no? I wanted you to explain that, doctor. I mean, you really make sure that it's screened, and there are some people who are like, "What? I can't like imagine my baby drinking someone else's milk." But let's go back a little bit into history before formula was very prevalent and commercialized, and we could get it anytime. I mean, doctor, you know this. Let's just talk about it. For those who are very like, I mean, freaked out or picky, in the olden days there were wet nurses.
Yes.
So the olden days there were wet nurses. So people who would give birth, and if they didn't make enough milk, then they would just give the baby to someone who had just given birth, and that woman would suckle the child.
Mm.
So I mean, we've been doing this since the start of humanity. Since
Mhm.
we've been drinking other people's milk. And keep in mind, when you drink formula, you are drinking like the milk of another animal. Not
Yes.
that there's anything wrong with that. I mean, thank you, cows, but I think we've exploited them also too much for their milk. You know, yeah, we've been exploitative. We're right towards cows. I mean, like, drink this milk and freeze it. I mean, we're getting their milk. I mean, kawawa naman. You're drinking another animal's milk when you could drink human beings' milk. And in the blood bank tuloy, the milk bank of Makati Med, for example, they do screening. And not only do they screen, they have a process afterwards where they pasteurize the milk. Is that after pasture? Yes. They pasteurize the milk, and then they also check the milk afterwards and do the test. So your baby's getting safe milk.
Yes.
So I mean, doctor, no, I don't know. I know you're an advocate of breastfeeding, but formula milk, like if you have to do it, I guess it's only been around since 1865, something like that, when chemists kind of figured out how to make formula and sell it. So, I mean, from cow's milk, perhaps, or I don't. I know I didn't read it, but I remember that, and it's only been around since that time. It's pretty new, and it's not to insult formula because some people need it, but let's just make it clear that it's kind of a new thing, and it's there because our lifestyles have changed so much. Modern humans, we move around a lot. We have refrigerators, we have cars, we have all these things, and it was there for convenience and also for survival, I guess.
Yes, for survival.
At that time, for survival, because if you couldn't find any other mother who had just given birth at the same time, then there was nowhere you could get milk. I mean, so primarily for survival, and then with its commercialization, of course, you can access it any time. But how do you feel? I mean, maybe you can give us some thoughts on breastfeeding versus formula, or just breastfeeding. You don't have to. I mean, I don't. If you're not against formula milk, I don't wanna.
Okay. So yeah, so I don't want also to demonize formula milk, because you're right. I think vast majority of parents, they really want breastfeeding for their babies because we know that it's really superior to formula. But
Mhm.
you mentioned lifestyle, and then the practice of breastfeeding is not as prevalent now. So there can be difficulties or lack of experience with breastfeeding with some mothers. Going back to work, it's also poses a big challenge towards continuing breastfeeding, because once the woman goes back to work, she has stress, she's away from her baby for a long time. It can be more challenging to continue the breastfeeding relationship. It's not easy also to pump, no? So, I'm not really against formula. I know that a lot of moms, they really want to breastfeed, but sometimes it's just not enough. So we have to resort to formula. But ayun, we know deep inside that breastfeeding is still the most normative, the most superior milk for our babies. Now, regarding the milk bank and the donated human milk, of course, it's really very good. No, it's also second best after direct breastfeeding. But the limitation to that is it's in very limited supply. So even if we have a milk bank, we can only supply those very sick babies in the neonatal ICU. And sometimes there's even, it just matches the need. There's not even an excess. Sometimes we reach critical levels. So we cannot just dispense it left and right, even to healthy babies, because the parents want human milk. It's very limited supply. So we really have to prioritize. We prioritize the sick babies, the premature babies in the neonatal ICU. So that's why we are appealing. That's why I invited myself to your program, because we want to promote awareness that the Makati Medical Milk Banks is very much alive. It's doing a lot of help towards babies. So if we are appealing to those moms who have extra milk to donate to the Makati Med Milk Bank, because you will really save lives. I promise you, even if you don't get anything, no money in return, but all those babies that you will save, you can always donate to the Makati Med Milk Bank. What else? So that's it. So I guess that's it. That's my message.
That's what you want to say, and that's your position. Excellent, doctor. And we know that formula is also for survival, primarily for survival, and secondary for whatever for convenience. No, I just want to say hello to the Taylor family. The Taylor family is watching from the UK. I want to say hello to Zamir, who's watching. Yanni's watching from Laguna, and Marjorie Bucal is watching. Doctor, is there anyone you'd like to greet, or any last any final words from you? You said a great thing already, but maybe there's someone you want to greet before we close up the show.
So I'd like to greet the excellent staff of the Milk Bank of Makati Med. You're doing a great job. Thank you so much. Sometimes you even do things out of pocket. I know that you go way above and beyond the call of duty, and I'm so thankful that you're still at it, even though because of the pandemic, the Milk Bank has been kind of relegated in the background. We didn't do a lot of promotion, but now that things are getting back to normal, we also have to get back to producing more milk, helping more babies, and promoting breastfeeding again, because of the pandemic, a lot of things that are important were kind of forgotten. So we have to go back to those advocacies, including breastfeeding, donating milk, etc.
If I could donate milk, I would, but I can't. I'll just maybe donate wine. I don't know. Anyway.
Well, you were inspired. Or maybe in the future, or if you have friends, you can just encourage.
Let's get the word out. So if you want to give milk, you can donate it to the Milk Bank of Makati Med. And as Doctor said, thank you to the staff there. I mean, for doing this, because you're saving lives. As you said, they go above and beyond, and that's always nice to hear. It's very heartwarming the way you said it. And breastfeeding is an issue that basically affects all of us, because we came from a mother, and we all could benefit from breastfeeding. Doctor, thank you for being on the program. Please come back on. Would love to talk more about breasts with you. And I need to see you in person. I mean, I'm going to make an appointment just to see you. That's it.
Sure.
That's your number. Unless you changed it or you blocked me or something. Okay. Thank you very much for being on the program, Doctor.
Thank you.
This was this reunion or of sorts was great for me. Because I've seen you. You look gorgeous, and as you said, let's get back to things. After the pandemic, things that were relegated to the background, it is important to donate breast milk. Thank you, everybody, for tuning in. Doctor, thank you for being here.
Thank you.
I miss you very much. And to the audience, message and call anytime. And thank you for watching. Thank you for those who said hi. This has been episode 7 on Healthline with Makati Med. And for this season, the topic was breastfeeding. And we have had with us the lovely, gorgeous Dr. Patricia 𝗂. And she is a doctor with a heart, just like Makati Med, the hospital with heart. I'm your host for Healthline with Makati Med, Nicole Jacinto. Bye, everybody. See you next time.
Thank you, Nicole.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.